and spoke with the client about their concerns. Also, in the defensiveness stage, other actions you would like to take are distraction, giving choices, and setting limits when unsafe behavior occurs. You're going to bed anyways right now.
Don't touch me. If you touch me.
In this scenario, the patient is in the challenging stage. You may see threatening behavior, threatening of self-harm. The staff use the incorrect skill of continuing to move into the patient, making the patient feel trapped. Now we'll look at a scenario in which the staff is using a correct action.
Forget it. Let's just go ahead. Let's put me to bed now.
Okay, then what I'm going to do is I'm going to go ahead and take your footrests off.
Ow!
In this scenario, the staff member allowed the patient to make choices, gave the patient definition on what they were doing.
Let go of me. Give that back.
In the physical acting out stage, the client is no longer safe. The client is batting at the staff, trying to hurt them. In this situation, the staff acted by not moving out of the way, putting themselves in the place where they would get hurt. Let's look at a scenario in which the staff is using the correct skills.
You know what? Just forget it. I don't think this is a good idea. Why don't you just go get the nurse? I'm hurt now. I need to see a nurse.
Then what I'm going to do is I'm just going to put your wheelchair thing back.
No, I don't want you.
Okay, it's unsafe for me to leave it like this, so I'm just going to take it away.
Just get the nurse. Just
okay, I'm going to go get help. In this scenario, the staff used the correct skill of moving out of the way and getting help. If you are ever in this situation, make sure you're watching your space, getting the help, and getting other patients out of the way. Are you better now?
I'm sorry. I didn't mean to start anything. I just was uncomfortable with you taking
Well, you know, when you hit staff, that's bad. Look at what you did to me.
I'm sorry. I didn't mean to do that. It was just...
Well, next time you need to watch what you're doing. In this scenario, the patient is in the learning opportunities stage. The patient was embarrassed about what happened, may show remorse, may apologize. The staff showed an incorrect behavior by lecturing the client, making them feel worse, and pointing out what they did and how it was wrong. Let's look at a scenario in which the staff would use the correct actions.
Come in.
Nicole?
Yes.
I got the nurse for you, and she's on her way. In the meantime, I do need to remain in here to make sure that you're safe and you're okay.
Thank you. I'm sorry. Just not feeling like myself. Thanks for staying with me, though. I appreciate it. I'll be fine.
How are you feeling right now? Are you okay?
Yeah, I'm not that hurt. Like I said, I'm just not feeling like myself. Thank you. I appreciate you staying. I'm a little embarrassed. Sorry.
What happened just now?
I was just scared about getting in bed. That's all.
Is it something that we can talk about?
Yeah, maybe, but it's a little too much for me right now.
That's okay. We can talk about it later. Just so you know, you don't need to be embarrassed. But what we'll talk about is we'll talk about what happened and what we can do next time to make sure that things go a little bit differently, okay?
Yeah, thanks for your patience.
Thank you. In this scenario, the staff first asked the patient if they were okay. That is the first thing you want to do, is make sure that there were no injuries to yourself or the patient. The next thing you want to do is talk with the patient. What happened? What can we learn from this? You also, in a situation, if there were other staff involved, make sure that you debrief with the other staff. Make sure everyone is okay. Find out what happened and what can you do to learn from this. Always report any circumstance or situation to your direct supervisor and record according to your individual company's rules. Always wash your hands or wear personal protective equipment during any circumstance. And always remember to report injuries to yourself or to clients to your direct supervisor using your company's individual procedure. Always remember the golden rules of safety. Never be in a closed bedroom with clients without others knowing your whereabouts. Always inform your coworkers of time and place of caregiving. Always know your clients. Always remain calm and never try to play the hero. Next, we will demonstrate for you safe self-defense techniques. The most important part of self-defense is space. If you're not in the area in which you could get hit or kicked, the likelihood of you getting hurt is minimal. In this circumstance, I'm standing away from my patient at least one leg length away, and that is plenty of space for me to stay safe. If she were to become aggressive, I could run out the door. Also, when it comes to space, you want to make sure that you maintain the safe presence. The safe presence is at least that one leg length away and off to the side. This way, if your patient needs to escape, your patient can escape, and if I need to escape, I can escape. This is also a lot less threatening than standing directly in front of your patient. The next piece of self-defense that is very important is the hit. Again, if I'm in my safe presence and my patient were to come at me to hit me, I could easily get out of the way. However, if I'm not in my safe space and my patient is coming to hit me, what I want to do is put my arms up to block it and get out of the way. We'll do that again in a little bit faster motion. And I would get out of the way. If I do not get out of the way, what's going to happen is she's going to come at me with her next hand. The next piece of self-defense that I would like to show you is the kick. Again, if I'm in my safe space, I'm not going to get kicked. I could see her becoming aggressive and I could get out of the way. If I were not in my safe place and she were coming at me to kick me, what I want to do is I want to step into the kick, turn my body to the side, and keep my foot on the floor. Turning my body to the side gives me less or her less of a target in which to hurt me. Keeping my foot on the floor gives me more stabilization. If I were to pick my foot up and she were to kick me, I would lose my balance and fall over and she'd be able to hurt me. Again, to block a kick, you turn to the side, keep your foot on the ground. The next piece of self-defense that I wanted to show you is the wrist grab. If you are being grabbed by the wrist, what you want to do is you want to use the element of surprise, and you want to go in the direction of the weakest point, which is the thumb and the forefingers. To get out of a wrist grab, what you do is you step in and pull out. Pull away from the thumb and the fingers. We'll do that again in faster motion. That time what I did is I used my other hand to add some extra strength and just pulled out in the direction of that thumb and forefinger. If she were to grab me by both hands, I would use the same thing. My momentum, a little twisting motion, and the use of surprise, going in the direction of her thumb and forefinger. We'll do this again in faster motion. Again, what I'm going to do is pull out. If she were to grab my hand with both hands, I want to go again in the direction of the thumb and forefingers because that's the weakest point. Use the element of surprise and a very fast motion. In this case, I may notice that I might not have enough strength to pull one arm out. So what I'm going to do is I'm going to reach in with my other hand, grab my hand, and pull out. We'll do that again in fast motion. The next self-defense maneuver we will show you is the